Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello, once again, my name is Luis and I'm here with Dr. Zahra Figueredo from the Stem Cell Healing Institute. She is the research and technical director of the institute. Dr. Zahra, hello, welcome back.
Yes. Thank you, Luis. Thank you so much for having me. It's always a pleasure being here.
Today, I believe we'll be talking about eye diseases. If you have problems with the eyes, especially if you have retinitis pigmentosa, if you have macular degeneration, general optic diseases, and how we can make it better with the stem cell treatment. Right, doctor?
Yes, Luis. Yeah. All kinds of these vision disorders, like you mentioned, the most common ones are macular degeneration, retinitis pigmentosa, optic nerve diseases like neuritis or drusen, and various different eye conditions respond very, very well to mesenchymal stem cell therapy. And what we do, and the reason why they respond so well is that the stem cells are placed so locally. And when stem cells are placed locally, they tend to do much better because it is right in the area. They're placed right in the area of the injury.
Ouch, so does that hurt?
That's a really good question. You know what? What we do, and you just got just perfectly. Your question was perfect because what we do is we place the stem cells retrobulbar in a retrobulbar injection. What that means is that we go from the lower eyelid and down and up behind the eye and place the stem cells literally right next to the retrobulbar space, which is right next to the optic nerve. And a patient can be sedated for it or with a local anesthesia. Many times we don't even use a local anesthesia because it's such a minor, it sounds more complicated than it is, but it's a very quick and simple and safe injection where we don't touch the eye itself. The bulb of the eye itself. We go down and up behind the eye and put the stem cells next to the eye, next to the optic nerve, which in many cases in eye diseases, the optic nerve is what's damaged. So it works very, very well. And it's placed right next to the retina, which is usually a very damaged part of the eye that affects vision also. So these injections and the stem cells work very well in regenerating damaged retinas, regenerating cones and rods which are damaged and degraded in retinitis pigmentosa, which are the cells that respond to light and dark. And then in a lot of diabetic optic nerve diseases, the stem cells are placed right next to the optic nerve, which really helps with optic nerve neuritis and optic nerve, any kind of optic nerve damage. So we get a lot of patients in this, especially with the diabetes and retinitis pigmentosa.
But how many sessions would it take for the person to start feeling better?
That's a really good question. We usually do one treatment.
Oh, wow.
And we prepare the body. We do one treatment with sufficient number of stem cells. And we don't only do retrobulbar injections. We also do an IV of the stem cells with mannitol, which helps the stem cells get into past the blood-brain barrier. And then we also do an intranasal aspiration. So we do three things. And we make sure that we're using enough stem cells. And that's the key. If we're doing it right and we're using enough stem cells, and not only is it important that we have enough stem cells, it's also extremely important that the stem cells are alive and viable and doing their thing, because we can have billions of stem cells, but if they're not alive and viable, then of course it's pointless. So it's really important, and that is our expertise in ensuring that we have not only the correct numbers to do a fine job, but also that the stem cells are healthy and alive and able to do their work.
This is one question that I'm sure people are asking themselves. Where do you get these stem cells? Where is the
Yes.
source?
Okay, so we will use a couple of different sources. In eye conditions and nerve conditions, we like to use the endometrial stem cells, which are from the uterus of healthy donors, and those respond really well to or diseases of the optic nerve and the eye. They respond really well to endometrial stem cells. We have other options also for patients that prefer to use their own stem cells. We get them from either the adipose or the fat tissue or bone marrow, their bone marrow stem cells. But in these cases, we prefer to use the endometrial stem cells that just do that these diseases respond really well to.
Okay.
I know what you're going to ask me, Louise. What else do we do with the treatment in the treatment? So, to make the treatment very, very comprehensive and so that we don't leave any stones unturned, we need to address and prepare the body for to receive the stem cells. So we do that by doing a pre-treatment protocol of um, some uh, some dietary changes that are key, just key dietary changes. We don't expect a patient to completely do an overhaul of what they're eating, but some key dietary changes. We add a few key supplements that not only help the condition of the eye, but also prepare the stem cells and prepare the body for to receive the stem cells. And number two, and then number three is just having a certain lifestyle with stress, addressing stress and and different emotional and psychological factors that can keep a person from healing. And that's one of the things that make us so unique is that we leave no stones unturned in our treatment. So we ensure that we're addressing lifestyle, diet, certain key supplements, and of course the emotional, psychological, and spiritual aspect of a patient that is so important in healing. So it's a very sort of complete, comprehensive treatment.
Great. I want to add that if you want to come to Guatemala, please write us to info@stemcellhealinginstitute.com and we can arrange everything for you to do this trip and get this treatment, of course, with Dr. Zahra Figueredo. Doctor, I would like you to tell them how you treat patients from all over the world.
That's a good question, Louise. What we do is we first start with a thorough history, a medical history. We do that by phone or Zoom, and that takes about an hour to an hour and a half to get a thorough medical history of the patient. And we do certain blood tests to ensure that's our screening process to ensure that the patient is healthy to receive the stem cells and that they're a good candidate for the treatment and that they'll have a good prognosis. We like to know that we're going to have a good outcome, before we take on any and every single patient. So we do this screening process first, and once they're approved, we proceed with making arrangements for their stay in Guatemala, which can last from 7 to 10 days, and that includes all of the treatment that's involved, the treatment package, if you will, and that includes a total detox program with a nutritional IV and suppositories and intramuscular injection of B vitamins, as well as a stem cell enhancement formula, which is a combination of herbs and minerals that again, just ensure that the stem cells are healthy and viable and doing their work. And then we also incorporate oxygen therapy, which can be in the form of hyperbaric oxygen or exercise with oxygen, as well as growth hormone therapy if appropriate. It's only age appropriate, because if we have children such as children with autism, we don't use growth hormone therapy. So it depends on the patient and the condition we're treating. So yes, that's basically the treatment in a nutshell.
Great. If you want to know more about these treatments, please visit our website. That will be www.stemcellhealinginstitute.com, and you can find out about this treatment and other treatments on our website. Doctor,
Thank you.
it was nice having you once
Yes.
again.
Thank you so much, Louise. It's been a pleasure. It's always fun talking to you.
Thank you. You take care.
You too.